Okay, sorry. Thanks. Well, thanks very much for inviting me out to meet with you. This is something that up until about a month or two ago, I didn't ever picture myself talking to groups, political groups, about anything at all, because that's not what I do. I talk to people about medical and surgical issues a lot, and I talk to people at my church about, you know, revealed truth, but I've never made a habit of talking to people about political matters. But things, as they're going along, have kind of provoked my ire a little bit, so I've decided to make my thoughts known. So I can skip the who I am slide because George already presented that. So healthcare, as everybody in this room knows, is kind of the latest battleground for America's liberty, really. And this has been going on for 70 years. Healthcare didn't just start up with this past inaugural. Most of you already know that this has been going on for a long time. But some people don't realize just how far back it does go. And what I want to impress upon you now is that if you get into this debate with people and you're discussing the finer points of managing the healthcare problem in terms of how much money we're going to spend, or how fast we're going to move, or who's going to get what dollars, or how we're going to monitor this group or that group, you have already lost the argument. If you're down in the weeds on social policy, on fiscal policy, on tax policy, you've lost the argument, because the argument is not a technical, managerial argument. It's a philosophical argument. It has to begin there. Otherwise, you've lost the debate. So what I want to impress upon you is that the healthcare crisis is a wholly manufactured by the government crisis. It's not something that comes naturally to the American way. It's something that has been given to us by some incorrect thinking. And again, it goes back to philosophy. And what I also want to impress upon you is that we can solve a lot of the problem at the state level. We don't have to think of this as a David and Goliath moment where we're up against the really big guy. You can start locally, and you can do things at the state level which will have a significant impact on Alabama's future, the future of families in Alabama. So everybody has a complaint. It's really important to understand. Most of us will hear one side or the other of the problem. They'll hear that, well, you know, insurance premiums are too high, and they're rising, and we're getting ripped off by the insurance companies. Or there's too much government bureaucracy, and this is what's driving up health care. Or people are making unreasonable demands on the healthcare system because they expect the best and they don't want to pay anything for it. We'll blame the illegal aliens. We'll blame the vendors of medical equipment. Everybody has a beef there, and I could spend some time listing those beefs. But actually, if I did, the talk would run too long, and then I'd have to leave in the middle of it. So, but what I want to impress upon you is that everybody has an argument, everybody has a beef, and it's all about injustice. Everybody on that list perceives some injustice, and the majority of those issues center around the fact that other people's money is being spent. The fact that the tax code is being used to pull money out of people's wallets and being spent in ways that you might not approve of. And so that's when you see fraud, when you see waste, when you see abuse, you see all those things precisely because it's somebody else's, your money being spent on somebody else or something else that you don't approve of. So,
if you want to be in the camera, you want to move over a little. And now
I'm good. Okay.
Good.
Thank you, sir. So the issue is, does the sense of justice, is that sense of justice based on unchanging truth, or are we living a life of situational ethics? And this is an important question to ask yourself, because there's two different models of government that are being proposed to the American people right now. And the one that sort of held sway in the last election is the government based on situational ethics. That things are different now, and so we can put aside the founding principles, because these are alarming times in which we live, and we need to take control of the problem. This is how it's always worked. There's nothing new about that strategy. But we have to be clear about why it's there and what we're going to do about it. So it's all about philosophy. The forces shaping the healthcare, quote-unquote, crisis are really twofold. Most of us know that science has had a tremendous impact on healthcare. You can't open up a newspaper or watch the evening news without hearing of some newest miracle in medical care. And we're encouraged to believe that it's because it's an ever-advancing science that this is what's driving up cost, and we're going to talk about that. Likewise, nobody can deny that the role of government in healthcare has had a tremendous impact on the direction in which medical research has gone, the direction in which expenditure of money has gone. And the philosophy is what informs both things. Philosophy is what drives your sense of justice, whether you think your government is just, whether you think any particular law is just. And likewise, philosophy drives science. Your desire for knowledge, what informs that desire for knowledge is really based on your philosophy, because there's been a whole lot of civilizations on the surface of this earth for many millennia, but we're living in a time that's unique. It's very different from the way things went, for the 10,000 years before, depending on your view of the time scale. Okay. Well, what I want to tell you, one of the most important points to gain out of this talk is that the hospital system, the healthcare system, the medical system, whatever you want to call it, is one of the children of the Christian worldview. Okay, healthcare, as you enjoy it today, and it has been around since the founding of our nation, and is certainly long before that, is one of the fruits of a Christian worldview. Okay, and it's based, to sort of simplify the whole thing, is based on the three theologic virtues of faith, hope, and love, or charity. Charity, of course, being perfection in the love of God. Now, if you have faith that there is an eternal destiny, and if you have hope that your actions are going to affect that eternal destiny, it causes you to do certain things. And among them is the care of the sick, the poor, the dying, the stranger among us, right? This is the Christian worldview, and this is where hospitals came from. They didn't exist before Christianity. It just wasn't out there. It has been imitated since Christianity. Islam sort of developed some hospital systems for a while there in imitation of the Christian world, but they sort of evaporated by about the 11th century. They sort of disappeared. So these issues of care for the sick, the poor, the forgotten, Christians are encouraged to believe that when you do that, it's as if you're doing that for your Lord and Savior, Jesus Christ. I was hungry. Did you feed me? I was naked. Did you clothe me? I was in prison. Did you visit me? So that the Christian worldview is that when you care for the poor, you're caring for Jesus himself. And this is called charity, which is defined as perfection in the love of God, which is kind of what's required if you want to really have a genuine hope for eternity. All right? So this is what caused hospitals to be created. The other important thing to take away from this is that you do not have to be a Christian to appreciate the work. You don't have to be a believer to look at that and say, wow, these Christians have done a tremendous thing. This worldview of theirs has produced this healthcare system that we all enjoy today. And the image I'd like to leave you with is the Pietà here. You could be a Buddhist and walk through the Vatican and look at that statue and marvel not only at its technical beauty, but marvel also at the worldview that caused this genius to produce it. And you don't have to be a Christian to appreciate this beautiful thing. But it's worth knowing that it wouldn't have been produced were it not for that worldview. Okay? So don't be ashamed to step right up with that fact. It was the legalization of Christianity that really caused the introduction of the hospital into the world's civilized scene, if you will. Patricians in ancient Rome had these little clinics that they would keep for the care of their slaves and for the care of their families, and a doctor would come and visit your home and take care of these either these slaves or these people. But there was no general effort at medical care in Rome. Okay? Hospitals, however, were among the very first efforts of the Christians when they came up out of the ground, when they came up out of the catacombs, when they came out of hiding. The collection of monies for the care of the poor and the sick and the dying was one of the things that Christians did. And attached to every church, you know, the church in Rome, the church in Ephesus, the church in Philippi, wherever it may have been, was a place for the care of the pilgrims, the sick, and the dying. And monies would be collected by that church and spent on those efforts. And this didn't go unnoticed. Obviously, this was one of the major reasons why Christianity grew so rapidly. See how they loved one another. This is one of the things that the Bible teaches us, you know, that see how they love one another. This is what people who never knew, you know, never heard the gospel would ask themselves, well, why are these people doing this strange thing of taking care of people they don't even know, spending their treasure on this stuff? So they applied what was then the technical excellence of Roman and Greek medicine, right? They didn't invent a new